Hello, my name is Adrian Richards. I'm the Clinical Director of Aurora Clinics and I'm a practicing plastic surgeon. Now in this video I'm going to be talking a little bit about labia minora reduction, and a little bit about who's suitable, the problems you can get from this area and what can be done. And in the future videos in the series I'm going to be talking about the techniques, the various different techniques that can be used, and also the recovery following surgery. So, just to be absolutely clear, the labia minora are the inner lips of the vagina, which are really the opening of the vagina in the vulval area. So the labia minora are the hairless areas, really the opening of your vagina, which are composed of sort of more dry, darker skin on the outside and slightly pinker skin on the inside. Now, everyone obviously has labia minora, but they do vary considerable in shape and size, and also interestingly between sides. Some people may be much larger on one side than the other. So some people are just born with slightly larger labia minora than normal, rather like some people have sticky out ears. It's just an area that is very, very variable. Some people after pregnancy and delivering their children notice a change in this area, and the labia minora can get larger and more swollen. So what most of the people I see are upset about with the labia minora is they feel they're too big, they're embarrassed about the area, and they're reluctant to for anyone else, perhaps their partner, to see the area, which makes relationships difficult. You can also get actual physical problems with them rubbing together and chafing, and they can become sore in some cases. And the other issue is that in sort of more close-fitting underwear and swimwear, some people are very aware that the labia minora may be visible through the swimwear, and may actually become visible in some cases, making it difficult to wear items of clothing which you'd really rather prefer to wear. So many people think that it's a very sort of vain area to have treated, but most of the patients I see who have considering this treatment have thought about it long and hard. They are aware of the area, they fear it may not be quite right, and it's limiting their lifestyle. They may be getting some tenderness in the area, and it's limiting the amount of clothing you can wear. So it's a real problem, and it can be treated relatively simply. So if you think you may have a problem with your labia minora and maybe a candidate for labia minora reduction, I would suggest that perhaps you schedule a consultation with us, or alternatively, if you email us your concern, we'll be happy to reply by email, and we can have a discussion as to whether this type of surgery may be appropriate for you. In the other videos in the series, I'm going to be talking about the different surgical techniques which can be used to treat enlarged labia minora, the results that you can expect, and also the recovery period. So thanks for watching the video. I hope you found it interesting and informative, and we either look forward to seeing you at consultation, and I hope you'll be able to watch future videos in the series.